Folks, welcome back to the Hurricane Age Show, the NBC Network, iHealth Radio, the iHealth channel, where innovation meets impact. Today's guest is Dr. Tommy Rhee, a sports chiropractor, author, and pioneer in self-free regenerative medicine with over 20 years in the field and experience working with UCLA Athletics and the Tampa Bay Buccaneers. Dr. Rhee has been in the front of performance and recovery. He is the founder of RheeGen, a patent-pending topical regenerative technology designed to support the body's natural healing without invasive procedures. He's also the author of The Future of Regenerative Medicine, exploring how non-invasive solutions are reshaping modern care. Dr. Rhee, welcome to the show, man.
Hey, man. I'm looking forward to this conversation, man. It's been a long time, huh? I was trying, reaching back and forth, playing phone tag or whatever it was.
Doctor, I have to say, the scheduling is probably the hardest part about doing this because it's just, especially there's a time difference now. It's changing a little bit of my stuff, and we do this stuff in advance. You got to plan it. But you know what? We got over that. We're here, and now we're gonna kick it off. First of all, I said a lot of stuff in that quick introduction, and of course, you deserve a lot more of that. I mean, obviously, we could spend a lot of time, but I have you. You will do all that good introduction in terms of your path. So, chiropractor, that's an intriguing space. And by the way, as you and I were just having a discussion a minute ago, I just had my chiropractor. Actually, the whole family, we all had a couple of sessions back to back last week, and bro, I have to say, we are feeling good. I mean, I think my neck is no more pain. I mean, I had so much pain. I mean, I do work out, and so my wife is in fitness, and my daughter actually had a problem in her spine, and kind of like she had a little bit of a, I guess, a little curve, and she got aligned. She's actually, standing tall right now. So we all happy about that. And the guy did some more work. I mean, he did some copying on us. It was fun. And to be honest with you, I have not felt this good in a pretty much a long time. The last time I had chiropractic work was 25 years ago. So after a work incident. So I have to say, your work is amazing. I appreciate what you guys do out there, and I know you guys are really helping some people that we all love, our athletic sports, world, all right, and teams in general. I mean, for those people that watch any type of sports, these athletes are always getting hurt. So let's talk about the journey. How did you even entertain being a chiropractor, as all the medicine and all the healthcare stuff that's out there? What drove you into it, and why specifically working with athletes? As a choice, because I mean, people do just general practice. You did a little bit more fun stuff. So let's talk
Yeah.
about that, and then we can deep dive into the science, because you got a lot of stuff that you've covered. And also want to just preface this to the audiences. Dr. Rhee has a lot more of innovations in his path, and we're going to talk about that as well today. So let's talk about your journey, doctor.
Well, I mean, like, I guess it starts when I was a kid, my dad was a surgeon in the medical world. And so I saw him treat patients, and I sort of liked the way, patients responded back to his, treatment, especially when you think about like what he had to deal with these surgical kind of like interventions, and it's kind of invasive, and then how they were thankful in a large amount of way that I started thinking about, oh, I want to do this, but I was an athletic kid. So then I was thinking, well, I want to go into sports, but I want to do it in a way that, because I knew I wasn't going to be a professional athlete. So I knew I had to be the supporting mechanism, like the sports doctor. So because of my sports background and then my dad's, career path and what he got out of it, I just kind of married the two together. I said, all right, I want to be that person. But I want to be a provider of these athletes, but I don't want to be the invasive world. I don't want to cut or give prescription drugs. So like when I was growing up, my dad never gave me medication or anesthesia or any type of like numbing cream when I had stitches from him. He said, "All right, you want to go get in a fight? You want to play sports? Here, get some stitches without any of this, like Novocaine or whatever." So so I knew that there's a reason why he didn't believe in it. So then I started thinking, all right, well, then you start going into what your body can do. Your body can heal itself if you put it in the right environment. If it's a spinal alignment, if it's your joints, if you get it in the right environment, it can heal. So athletes like that same thought process. They want to have the best out of their own body so they can perform better. So because of that, I started going that way towards chiropractic and not medicine. So with my world of going in sports, I knew where I wanted to go, and I try to find, you always want to find a mentor that can move you in that world. So I found a mentor, and with that, I was in Los Angeles, and luckily enough, I got with UCLA. And UCLA allowed me to see these elite athletes, these collegiate athletes. But the neat thing about UCLA is I get to see all the sports, not only like maybe the classic things like football or basketball, but you're seeing like water polo, tennis, golf, just unique gymnastics, soccer. You're seeing all the sports, and that allowed me to see their typical injuries. And then with that, it made you go into the world of like they want the best out of their body, but you have to do it non-invasively. So that's why I got involved with this thing called ART, active release technique. That's like a soft tissue manipulation. So when you're in the sports world, you're not looking at the spine just by itself. You're looking at the shoulders, the knees, every other joint that really helps this athlete perform. So because of that, it gets very complicating. And then those complicating cases becomes like a challenge, and that challenge is fun. It's like solving a mystery. So because I started crafting my sport there, in the ART and chiropractic and sports world, these kids will graduate into the professional world or the Olympics, and you go along with them. So now I'm going in that level and I'm starting to see what they do there. So they have a team like a doctor and a therapist and how they take care of their bodies. In addition, then you start seeing what they do off season. And then off season is where they get involved with regenerative medicine, like stem cell therapy. So that I saw that way back in 2008, 9 when they started off with this prolotherapy, then moves to PRP and stem cell. So I saw this thing evolve, and then I had to be knowledgeable because you have to understand what the athlete's going through. So then you would do research and understand it, and then eventually you would provide that service for those athletes. So now I'm in the professional world. Now I'm seeing all the caliber athletes at their higher performance, and every time you go up a level, they want the most and the best out of me. So then I have to tune it up. So the neat thing about that is that then I started working with the Tampa Bay Buccaneers. Then I started working with Olympians. Then I started working with WWE because they want that kind of care. And the neat thing about that is they've been through other chiropractic or physical therapy or other medical intervention, but they didn't get the results. So they want someone unique like me that's kind of innovative, kind of like thinks outside the box. And that's what I do. I like to think outside the box, and I see there's a better way of approaching this injury or this situation or problem. And then from there, we just kind of solve it because each individual person is different. Like I look at you, I look at this other person, but we have different kind of like, type of like anatomy or some type of issue with the problem. Well, you have to address it differently. You may have to be just like simple, like a chiropractic adjustment, where this other guy needs more of an aggressive type of therapy to break up maybe some long-term scar tissue material. So with that, it just got me in this world of like solving problems. That's what I do, solve problems. And then when I start solving problems, then you start going into the world of, all right, not only am I physically solving problems, but let's go to the next step. Let's look at the grand scheme of things. How can I scale this out to larger people? And that's why I got involved with the stem cell therapy and then learning about how can I get this to other people in their hands without that world of injection. So that's how that developed into that world of regen. So I hope that cleared all that world of how I got here.
Well, there's quite a bit there, and we can break it down a little bit. But before, let's because I think for our audiences, I mean, there are a lot of us out there that are somehow, I guess, active in terms of the space of sports in general. Some of us just go to the gym. I mean, we that's pretty common. Everybody goes to the gym, tries at least to do some pumps and get some weight in there. Sometimes we do a lot of wrong stuff. And of course, you have all the world of actual sports. Whether it's football, baseball. I mean, you named a few others that most people don't even pay attention to. I mean, soccer is a one that's huge. I mean, around the world. Olympians. I mean, running is a big thing. It takes a toll on you. So just if you don't mind, Doc, you can just share with us a little bit of like how do literally people injure themselves without even knowing? Because I think that's a very common thing for all of us out there. We think, listen, my son this week literally it just happened. He was working his shoulders up, he's doing his thing, and he comes in, he's like, Dad, I can't move my arm. I mean, literally, he just couldn't go up. And I mean, I figured he had a muscle, spasm, or he has a I don't know, maybe what do you call that tissue a problem that you just maybe um what's the technical term of that? I
I don't know,
kind of
there's a
forgot
muscle
about
tear, scar
muscle
tissue.
tear. There you
Yeah.
go, muscle tear. So I think that's, I mean, that I'm not a clinician, so I was just like, I'm trying, let's chat GPT this thing. But really, luckily, I mean, it wasn't bad. It took him 2 years, I mean 2 years, 2 days or 3 days to actually get a little bit of emotion. Now he's back, today, his first day to the gym, actually. But really, it's we do this to ourselves. I mean, my wife last year, she kind of sprained her ankle, and she's still in pain. So
Mm.
I mean, I'm talking about just personal experiences from the family, but I think that goes to everyone out there. I mean, you can just be walking and twist your arm or your leg or something. I don't know how, but you can do it. You trip, you fall, whatever. And of course, if you do any impact sport, that's even worse. So what is it that we do wrong? I mean, your expertise, like, or something that we can avoid, before the damage is done. Obviously, you are treating these things, but there's always, we talk about preventative measures. Are there any, or is it like completely unstoppable? It's something that we cannot prevent.
Well, here's the thing. I think when it comes to working out, we have that old saying about no pain, no gain. So you try to fight through
Oh
it.
yeah,
But you have to identify, is it pain from fatigue or is it pain from injury? And if you have like an injury, like a micro trauma that's like a micro tear, and you start pushing and going, I want to push through this thing. Well, that little micro tear becomes a bigger tear, and all of a sudden it becomes like something that's inhibiting your action. So that's one factor. And then there's another thing that you have to be careful when you work out. When you do anything, it's about just, everybody knows about working out to build muscles, but they forget about the second half of that, which is recovery. You've got to have the ability to get those muscles to build back to itself. Working out is about breaking down muscle tissue. But if you understand about recovering, well, that's a secret. You've got to get that recovery mechanism. Either you rest longer, so then your body's back to 100%, or you need to introduce it with something that kind of speeds up that process. So that's another thing. Now, a perfect example that you're talking about is your son and your wife. So your son, he basically rest and his shoulder got back to better, right? So that's good. So he had the recovery. When it comes to a sprained ankle, when you sprain your ankle, the tough thing is that you have to constantly move. You can't just stop walking. You have to walk, but so you're not resting it. You're constantly using it. So you're still giving it trauma. You're not allowing it to rest. So that's why she still has that ankle issue. She either needs a rest or get good therapy and get that kind of like that recovery going, or remove whatever she got as far as scar tissue material or excess fluid. She's got to get it out of that joint. So it gets complicated when you get in a chronic situation. I like acute injuries because acute injuries, you can just control the mechanism of healing and get it properly going, and then it's perfect. When you go to long term, like you're dealing with something for like 6 months, now your body is doing all kinds of like growth and trying to change in the biomechanics. Where now you may have an ankle, now it's a knee problem, now it's going to be a hip problem because you're always adjusting. You're trying to like compensate. So those are good complicating cases. So when you guys are out there getting injured, see someone like me right away so they can stop that long-term issue that you may have.
I think that's a very wise advice, folks. And again, don't make the mistake, that we think we're resilient, we can handle it. The body's, and body does actually recover eventually. But again, do you want to take the pain? I can tell you, I used to have that mindset back in the days I was younger. I'm like, okay, this is good. I can take the pain. I'm at an age right now when something hurts, I gotta see somebody because I just can't. I have to say,
Yeah.
because as that's the other thing, like there's different levels, age groups, right? As we get into the lifespan, your body is not the same. I mean, when I was 20, I thought I was invincible. Now I know I'm not, and I'm a lot more, careful. And when I talk, for example, to my kid, my son is like, "Dad, I mean, that's too much. You worry too much." I'm like, I know how it feels when you get hurt, and I've had quite a few ones. I mean, I've been in martial arts for a long time, so I've had, broken bones. I've had, tissue problems. I've had all kind of stuff that you can possibly have in the fight. I've had it, in training. So I learned to be very careful. I'm very cautious about how I do a warm up. I do whatever I can to stretch to make sure everything is good, and that's okay. People look at me funny. That's okay. You can look all you want. You can have fun you want. You can laugh it out, but I'm not gonna allow my body to actually get hurt because now I can't work out. I can't do things, and I gotta maintain. So it's a problem for a lot of us sometimes. When we think that it's just go town, let's do it. So I learned to do that. But so for our audiences, folks, I think the best advice is what Doctor just said. You feel a pain, don't guess it. Just seek help because the sooner you get that, I think the better you'll be, and the least impact it will be on your life because it could be sometimes bad. I mean, I'm sure, Doc, based on your expertise, you've seen stories where someone didn't do the right thing and it took them forever, or maybe they didn't recover. I mean, is that even a possibility? I don't know, Doc. You can tell us.
Yeah. The worst thing that I come across with patients that let's say you post-op surgery and then you don't do let's say you skip rehab because I don't need rehab, I'm just recover on my own. Well, the problem is that when you traumatize your body through like an operation, like a surgical procedure, you create scar tissue because it's trying to do things like heal what happened, and then the body somehow lays more down than it should. So if you don't move it correctly, it's going to lay down places where you don't want to lay down. So it inhibits your motion, your actual like the flexion of the knee or something that you need to do. So now you take yourself in 2 year period and then you come see me and you say, hey, I can't bend my knee all the way. We take a little history. We find out you had surgery, you skip PT, and now you want to go ahead and get that range of motion. I said, okay, get ready because we're gonna get whatever you missed, we're gonna catch up now, and it's very invasive. It's very, I wouldn't say invasive like I'm cutting you, but it's very extreme in the sense that I've got to force it. And you will hear some rip, you will hear some break of that scar tissue, and it sounds nasty, but we got to do that if that's what the goal is. So if you don't address it quickly, you're going to go through a lot of pain for the therapy that I have to push you through to get that range of motion or that function back in that joint. And then, going back to what you're saying about aging, how when you're young, you didn't do anything, and then you imagine if you had that same mindset and send it back to like, 30 years ago and have that mindset, how much better would you be right now, right?
I listen, I can say you're a trillion percent that this is like the $1 million question and the solution. I wish. I mean, and by the way, that's what we're doing this, right? We hope that other people can listen to this and take it to the bank. Folks, you don't have to test it out on your own. I mean, it will be painful, as the doctor said. Eventually, if you don't take care of it, it will be just painful. You can't evade it. It's going to be there, and it's just going to make your life miserable. I see people sometimes that haven't taken care of themselves, and they can't walk properly. You have a cane, you have this, you limp, all kind of stuff. Like it's a problem, folks. And frankly, Doc, one thing that I think we all misunderstand about our body. I mean, it's not just we have bone, we have muscle, we have ligaments. Each one of those operates differently, and sometimes we just hurt everything.
Yeah.
It's crazy. So Doc, your world, athletics, and sports folks, and I guess athletes in general, right? They they go through quite a bit of routine, and they usually are safe because they have an environment, they have a whole team that helps them. Yet injury still happens. Um, so how do you take care of folks like that? And for example, a great player that needs to be on the scene. There's a game coming up. I mean, just for our audiences, I'm just intriguing question for you because you see people that get hurt and on the next game they're out and phenomenally working, and it's like how did they even recover this quick? You talked about recovery, but like, is there anything like magical other than invasive stuff? And before we get into your therapies and your I guess your solution, your RheeGen concept, what were there? What measures were there actually for these folks to get them really be ready in no time? I mean, because it looks for us watching a game, it looks like, oops, they got injured last game, they're back. I mean, obviously, if it's an extreme thing, it's a moot point. But certainly, you guys, I see that you guys make miracles. I've seen actually, athletes that get completely. I think that these guys are out, and they still kind of fix them up, and they patch them, and they're back into play. So how do you guys do that?
Okay. Here's a funny thing about that whole scenario that you're seeing. So when you come to that level of professional athletes, team, and the game's on the line, and you're looking for that type of like, you know, Super Bowl appearance, these athletes understand what they do. So during the season, it's not so much about like advancing your athleticism or trying to advance. You're just trying to maintain. Off season when you're trying to peak performance. And then during the season, you're just trying to like sustain. So that's why it's not aggressive as far as the workouts or anything that you want to like push on off season world. It's more so just surviving for the next week's game in the NFL world. So next week's game. So when you do get injured during the game, it's hard to recover from that with a basic type of like a passive therapy or something that has to do with rest because you have to speed up in order for you to play next game. So believe it or not, most of that stuff is going to be managed by like pain management. It's when it's that typical stuff that you're going to hear like injections, numb the area, shut it down. And that's why you always hear about like off-season surgery. He's going to do surgery because they know that they injure themselves like maybe week 7, 8, but they're going to do something to mask the pain in order for them to continue on the season. And then after the season, they'll do the surgery. So that's why you're seeing these guys recover fast. It's mostly like pain management. Now, the neat thing about that is that regenerative medicine can be a category to be, helping these athletes out. The problem is that it's the delivery mechanism, the injections, because the injection creates that little trauma, and then there's a downtime. That's why you don't hear about stem cell therapy during the season. Well, that's why a topical application is a fantastic, other source besides injection. So again, we'll talk about that later. But as far as like when you look at athletes and how they work out and how they, there's an in season and off season. So in season, it's about just maintaining, just staying alive for the whole season without an injury and at that type of performance that you had when you developed off season. Now during the off season, these athletes are walking a fine line. They're walking that fine line between, being injured and peak performance. You want to go on that edge. That edge is very fine. So think about like you're trying to speed up like your ballistic jump. You want to jump. So you're asking your body to go in an aggressive mode and explode. And that explosion, you're taxing your muscles, tendons, ligaments, and you're trying to almost like tear it apart. So when you try to tear it apart, you're breaking it down. And then you get that rest, recovery, and then you build it better. And here you go. Now it's stronger and you're doing that higher jump, that higher ability, right? But if you go too far over that workout, now you injured it. Now that recovery is not days, it's weeks. So it's a fine line. That's the most interesting thing about working out at the top like elite athlete is knowing that fine line and having a good team around you, trainers, person like me, all these things that kind of help you along because you're going to be injured. No matter what, if it's off season, on season, you're going to get injured. And then when you have someone like me, we can speed you back up to get you back to normal as quick as possible besides being on your own. So I guess the big thing with that is that when you see it on TV, it's mostly in the season pain management.
Well, that's scary. I mean, like, I mean, I've always wondered, like, I figured there's something that they get to fix them, to get them. But I mean, running on pain management, I mean, it's like you masking the problem and you just kind of going through it. It's like when you're having a bad headache and you just keep, putting Tylenol and stuff. What I mean, I'm talking about just off the counter stuff. You guys probably use some more, extensive stuff. But at the end of the day, it's the same concept for like your common folk, out there that just, I got a little headache. Let's just keep popping to maintain to go through the day. But the underlying issue, the actual root cause is still there. And I think that's the problem. And to your point, off season, now you have surgeries, you have this stuff. So that now you kind of touch on the non-invasive stuff, but I want to just ask the question about invasive stuff. I mean, it kind of was the next thing, right? Or the best thing at a certain point. But to your point, it's not the ideal because it does have, I guess, problems that come with it. Let's
Yeah.
talk from a science perspective. Even if we can talk about like what is the stem, because you mentioned stem cell therapy. If you can just break it down a little bit to our, normal, person watching today around the world, what is that? How does it work? And why did it work? And why is it not really recommended? And why we should be doing non-invasive? Because again, for someone like me, I would avoid anything that goes inside my body or cutting my body. That's just me. But and actually being in the healthcare for a minute, talking to a lot of doctors, I had a lot of surgeons that say you cannot, if you don't want to go, if you shouldn't go under the knife if you don't have to. If you can avoid anything that goes into your body, that's a good way. Obviously, if it's the only way to solve a problem, I mean, yes, last measure, last resort, but not the primary choice of selection here. So let's talk about that, Doc.
Okay. So the biggest risk when you hear the word invasive is that when you kind of like cut through the skin, because our skin is a protective layer, right? We avoid that world of like bacteria infection and viruses and all. So it's our big defense mechanism. Once you penetrate through there and whatever you're going in there with, a syringe or a suture or something, you're introducing your body to the environment. And then, whatever's airborne or is actually on the, let's say, the suture right, or something you're cutting, right? Well, if it has a little bacteria in there or whatever you're introducing into your body, Well, now you don't have that protective mechanism in your skin holding back. Now you're right away being attacked real quick. So that's the biggest factor is infection. You don't want that world. You hear about some guys out there do surgery and they have a bad infection and it took them months to recover from an infection that's like attacking their leg and then they almost lost their leg because of this infection. Well, that's a risk factor. So when you hear that world, including the needles or anything, you're in that kind of like the risk factor. So when you look at stem cell therapy, stem cells, let's go back. The stem cells are like these little kind of like these signalers for our bodies to do something. So in the old days, we also say that we have to get these things called mesenchymal stem cells, these live cells to go into your body. And when you go into your body, it's supposed to what they call differentiate. It turns into your tendon, ligament, muscle. It does something, right? So as we get more like, how would you say, intelligent in the world of stem cell therapy, we started understanding it's not about the live cells. It's about the signals these live cells give out. And the signals are what's really important because number one, live cells have a nucleus and then it has a DNA. When you have a DNA, you're giving the ability to do something to replicate into something. Now, here's a problem. You don't know what it's going to turn into. You think it's going to turn into a tendon. Well, maybe that DNA is meant to say it's a hair follicle or liver or something, right? So you don't know, but it's live and it's going in your body. So right away, your body's going to say, hey, there's a virus or antigen that's going to attack it, right? That's why a lot of people talk about when they get these live cell injections, they feel sick the next day. It's because your body's kind of doing that world of being, fighting a cold or a virus in your body. So with these live cells, it has a risk factor. It may turn into something, and then that something could be a tumor, right? It's doing something it's not supposed to do. Now you take the next step, which is a cell-free, the stuff it secretes, that they call it extracellular vesicle. All this is information. Information is, in the form of like a protein and some type of like information that sends to your body, hey, this is a target tissue, do your job. And that's what this is all about. It's signaling your existing tissue to grow, to do something. And that's where cell-free comes along. So the neat thing about that is that now you have to think about how do you deliver it. So right now it's delivered through a needle. So you take the needle and let's say it's your knee, you have to go, through the skin to that, let's say it's an ACL of your knee. And then you get into that area and then you puncture the ACL to deliver that information, the stem cells or the EVs, right? Well, believe it or not, you have a primary injury site and then you made a secondary injury site with the needle. So now you got two injury sites. So you're thinking like, all right, that's why you can't do these injections during the season or, if you're an active person, they say there's no activity in the next 2 weeks because of this injection. Well, that's not fun, right? You want to be active while you're doing regenerative or therapy. So now you have to think like, how do I get this into my body without that invasive needle? Well, then you have to work on something like I have, which is a topical application. Because right now, I'm not looking at live cells. We're looking at those like the cell-free. It's a smaller molecule and it has the ability to signal your existing tissue to do its job. And that's what our body does. It sits dormant, says, I need information. Because we have a receptor and then a little bit of information and it just connects to each other. And when it connects, it says, all right, let's do our job. And then now you got growth in your tissue. So that's what this is going to happen here. So now since the molecule is closer and smaller, now you can do an application for a topical. Topical, there's a transdermal agent that can pull through the skin because it's so small molecule that it gets down to the deep tissue. Now you're not in the world of needles. You're not in that world of invasive or infection. Now you're in the world of just simple application.
Well, I think you just solved the problem in the world because everybody is afraid of all these things. I mean, you hear needles. As a matter of fact, sometimes we've heard of stories where someone, especially you have an accident, they place a needle in your neck or whatever on your back. Sometimes it can affect your spine or whatever, and now you have mobility issues. Even paralysis, has been reported in some of the cases that are, I guess, uh, out there, right? So it's a little scary, but I love how you just broke it down to simple words. I mean, it's not that difficult. It's not alive, and I love the concept that yes, when you put something in your body, the system is going to say, well, what is this? foreigner, entity that's invading my my pathways here. Let me just go and break it down and kill them. And you're right. That's your sign of infection, or at least that's your reaction. You get all these antibodies, doing the work, which is cool. But they're just hitting the wrong, stuff, and you're just wasting time, money, effort, and probably getting sicker. But I think your design is unique, and that's the thing. It took you what, 3 years to actually get the right stuff. I mean, did I read that right?
Yeah, I mean, realistically, my thought process was probably like 5, 7 years because the question was always there. Question was always, why can't we do stem cell injections during the season? Why can't we deliver a different way? And then it just started evolving into like, could it be this? Could be. There was one time I was looking at nasal spray because it gets through the nasal area of the sinuses, and there's blood vessels in there, but it's not really localized. It's systemically, it goes through your whole body. So that was one approach. And then we went to topical, and then we're thinking like, all right, the topical, what are we doing here? What is the mechanism? How do we get it through the skin? So those are the questions that I asked myself. And finally, I said, all right, after that, kind of like that idea goes, let's see in application mode, does it really make sense? And, through studies, we had a great outcome. So right now, it's fantastically delivered. And the neat thing about what's going on now is that when you understand about signals, that's all this is about, signals, not the live cells, but the signals that you're trying to tell your existing tissue to go and do its job. Then you start thinking about, okay, this is a human tissue source that I'm getting this information from. Fantastic, The problem is there's a cost, there's all kinds of other factors in there that, brings up the cost of that particular thing. So then you start thinking, all right, I'm just looking at signals. Then you start doing more research and you find out there's plants that have the same signaling for your existing tissue. Now you say, okay, this is interesting. So then you start looking at each target tissue, which is a tendon, muscle, ligament, all the bones, all that stuff. So then you figure out, all right, what are the signals? What are equivalent to these things called like, transforming growth factors, beta and all that stuff. Then you look at these things and you find out the plant, and then you see, okay, there's an extract plant that does the same thing. There's so much research out there that now it's like makes sense to go ahead into the world from human tissue source to plant source. Now, the neat thing about that is that, we've developed this whole formula. It's transforming from the human sourcing to plant source. The neat thing about that is that now the cost is a lot less, a lot less. Now, when you're talking about a lot less, now you're talking about less than $100 versus $1,000 for the topical, and then the injections $5,000, $10,000. So the cost is coming down. So RheeGen's coming out with a new product that does the same ability of the actual like the stem cell world or the human tissue source, but a lot cheaper cost. And the neat thing about that, it's safer too. So we are excited about this. We're right now finishing our patents, we're finishing our trademarks, so we're moving towards that. We hopefully launch about August of this year.
I'm listening to you. My eyes are getting bigger. I'm getting a bigger smile here, because I'm just listening to you. Like, because I was going to ask the question. I mean, how do you even create this stuff? Is it from like, I guess, humans or animal based? But now you said it's plant based. So a lot of people may not want to entertain anything that is, I guess, body born. Like another human or another animal. But certainly plants. I mean, everybody's like the organic version of things, and it's healthier to a degree. There's less complication, I would say. And I love the way that you presented it as in terms of signals. I mean, it's amazing that our body is really a big neural system that is operating. There's all these synapses firing up and down, and signals transferring from one cell to the other. I mean, we're not any different from a computer when you're talking about programming and sending those signals to it. But you've got into that level of depth in terms of how we operate and where the pain is, and you kind of basically figured out a solution that is non-invasive and certainly uh, easily accessible to a degree, because we have a lot of plants on the planet, at least for now, hopefully, when the environment stays that way and maintains. And, you've solved the problem of rejecting anything that is, animal, human based. Also, to your point, you also solved the biggest question, which is the cost. Because when you're talking about anything that is treatments, cost is always a big deal. And a lot of people may not have access to such things because they just can't afford it, period. I mean, we're talking about big teams, maybe they have the means, but we're talking individuals out there that may have similar problems. I mean, the common person like me going to a gym, you get hurt. I mean, it's going to cost you, right? So I might that, and that's the other reason like people don't go to doctors or any service because they just can't afford it. I mean, healthcare we know is in general not a very affordable, especially not in the US, but all around the world. Some people may not have access to the tools or the even facilities, let alone the actual, experts, right? So it becomes very difficult. So I think you solved a lot of problems and a lot of, you found a solution that is kind of mitigating all these questions. And I love what you said. It's not new because you worked on this. I read 3 years, but it looks like this is something that you've seen, you observed, and that's the other thing that I was fascinated about looking at your work is that this is not your first innovation. You've done things, you've created things, you've had a few things that led to this, and you've always tried to do something different to contribute. And yes, I mean, it makes you an innovator. But here's the thing that made me laugh the most: RheeGen. I mean, you know what I mean? Like, people think like regenerate, right? Regenerative, but I mean, how did you even come? I mean, it's like, what are the coincidence to have the last name as such?
The
you
funny
know,
thing is, yeah, that it's great subject there. So, I was going to spell it like just like how typically, when you see it in medical journals, are REGEN,
Right.
right?
Yeah.
So I was thinking about, I was like, hey, it looks pretty cool, regen, and finally this little, lab guy he looks to me and goes, hey, your name is Rhee. I goes, yeah. He goes, why don't you stick your name in there? I said, huh. And then I started thinking about it. I goes, okay, that sounds cool. That was just that simple. Because oh my gosh, so cool. I mean, I knew that Rhee had that you know that similarity to the re art, like a pre, like
Yeah.
rehab,
Yeah.
recovery.
Yeah.
So and I'm starting thinking. Then when that opened my eyes, I go, oh my gosh, I can just go ahead and just go and shoot it all down and rehab. But then I get the words like reject and I got other kinds of re. Wait a minute, I got to slow down with all these other re's here.
Well, yeah, but it is. I mean, listen, it worked out, but it's impressive. I mean, because really, what you're doing is regenerating, things and cells are operating to optimum. And now let me ask you a question. What is the time frame? Now you put the topical, and by the way, I love the idea that it's isolated. You can literally just touch the area where the pain is, put the topical in there, and let it, work the magic. Before you know it, you have results. Uh, as you said, the other stuff, like even when you take pills, I mean, it's got to go through your bloodstream, it's got to go all over the place before you even finds, where the problem is. This is like direct. It's on the spot. You know where to go. You zone in, you home in, whatever the word you want to, So it's really that focused access. Boom, done. So it's I think it's something that we all have to adapt to in today's modern world. So I know you'll be launching this big stuff, and you said August, right? The deadline is correct. So this is going to be a breakthrough in a lot of places. I mean, first of all, I think all the teams will be like all over you, man. I don't know how you're going to do that, but that's good. That's a good problem to have, and I wish you all the success there. But really, I think it's a miracle. I mean, talking about, listen, I've worked in the insurance space and healthcare with seniors. That's an area. Seniors, everything is pain, man. I mean, you hit that 50 mark, and I've already started that point. There is pain, folks. I don't care how you do it. I'm very athletic. I do my stuff. I eat well. I talk the talk. I walk the walk. And guess what? Pain is like every day is a new one. You don't know where it's coming from. It's there somehow. I don't know if maybe we're deficient in something. I try to be, not deficient, but this is a reality of things. Pain is there. So this can actually be very good. I mean, the closest to this is like we talked about psychedelics and stuff like that before, and some of the topical, application of CBD and things like that. That's more pain management. This is the root cause that is actually being resolved here. So I think there's two different things. Those work for pain management when there is nothing you can do. This works for this is the problem. We'll solve the problem. And I think that's the thing for most of healthcare. What we hear a lot more today about is that it's more sick care versus preventative care, right? So we're sick, we have a problem, we fix the symptoms, we try to solve them, we mask them, pills, whatever it takes. But really, the root cause is never actually there. Even nutrition, we have obesity. What is the root cause? We eat a lot of junk food, ultra processed food. It's in the nutrients. We have deficiencies in our soil. So we can talk about all this stuff. But what you've done here is different. Here's the problem. We know where it is. Here's the solution. We put it, we apply it, and boom. Now, question, Doc, how long does it take, for example, someone who has a knee injury or some sort of a major muscle group that is kind of hurts to recover using, and what dosage? Do they have to have hundreds of applications, or maybe a couple of them that are very concentrated to get the job done?
Okay. So, of course, it depends on the injury, right? So, if you look at something that's like not too bad in the sense of grade, right? We have a thing called a grading system of a tear. If it's a ligament or a muscle, you have like grade one, two, and three. One is like a little tear. Two gets a little thicker tear. Three is pretty bad, and four is a complete rupture. So, here's the thing that you have to understand is that if you're at the lower stage of that grading system, then you're looking at something that when you apply RheeGen, you're going to have to understand it's the process. It's a daily process that you're going to send the signal to your body. You're going to saturate the area and it gets that signal down there. You're going to feel pain reduction right away because there's anti-inflammatory properties in there. So once you get that in your body, it's going to reduce the pain. Now, talking about sourcing, right? So you want to go to the source of the problem to get that fixed. Where the other ones just basically mask it. Once you get to the source and you're sending the signals to tell its job to do with the healing, you have to regenerate, right? So once you get that system going, it's going to take a period of time, 30, 40 days to get those cells to start multiplying, to start dividing into itself so then it grows itself. So that's what the whole thing is that your first step is pain reduction. Of course, it does that with decreasing inflammation. But the second part is a little longer process to make those cells grow back to where you don't have that pain anymore. So with RheeGen, we always say about 30-day application. When you go 30 days, then you're into it. Now, with the plant-based, the great thing about that is that it's going to be more inexpensive, so you can really go past the 30 days, 60 days, especially if you're a repetitive, kind of like an active person that's always feeling that knee pain. Well, once you get those cells and that system back to its normal, and then you go work out and you injure again, well, you have to send a signal again. You have to constantly send signal because you're always beating up that body part. So you're not going to hurt yourself by applying over a period of like a year every day. Just make it a protocol. I get up in the morning, I rub it on my knee, I'll go do my activities. So it's like one of those things like, you brush your teeth, you put RheeGen on.
Well, I like it. Well, so question, Doc. Can it be applied as a preventative measure, meaning that even if you don't have an injury, can you, you know your muscle groups, you know what you're doing, maybe the joints that are usually impacted the most, you can just apply this as just like how you have those sprays and things before you go to work out. This you can use something that is solid now that actually works in advance of your almost like anticipating a potential injury, so you don't even have to get there while you're doing the process. So even if there is something you're already ahead of the game. Is that a possibility?
Oh, absolutely. Remember, the secret is preventative. You want to do what they call prehab. You want to do everything you can from a proper exercise, warm up, dynamic, and think about everything is nutrition. Get the building blocks in your body so that you can get ready for that, and understanding your workouts and maybe preventing the injury in the future by doing that proper regen product.
Rhee, huh? I
Regen.
love it. I love it, man. I was just gonna come up with stuff in this show here today,
I love it. I
but
love it.
but doctor, now we have the concept. Well, not the concept. We have the product. It's going to be in the market. Now, is that available in the States only, or will it be patented and globally available to people anywhere? How
I,
does that
I,
work in that
yeah, I
way?
hope it's globally. Right now, the way I'm looking at it is that it's going to be an OTC, over the counter, FDA compliance type of product. So it's going to be in the United States. It's going to be available overseas too. That's the next step. I haven't gone to my international thought of like how to protect that type of IP. So right now, I would love to figure out that process. But right now, I just look at the United States and maybe just Mexico and Canada and the neighboring countries. But that's a great question. I haven't thought about that one yet.
Listen, North America is huge. There's a few million people in there that can benefit from it. We tend to be a very physical, I guess, entity. Our sports are kind of very difficult. But again, you have the world of soccer, or as they would call it around the world, football. That's a huge. We've got the World Cup coming out to the States,
That's
in the
cool.
summer. So you know what I mean? I think you'll find, a huge appetite for that in terms
Yeah.
of what it is. So
Well, what's interesting is that when you look at people like, 50 plus, we look at health. Health is more important than physique now. We want to be perfectly aligned so we can get to the 90s, 100, and still be active. There's nothing worse than seeing like a 80-year-old person that can't walk, but they're alive, but they can't be enjoying life. So when you think about exercise and you want to think about how to like benefit from exercise, well, you have to move. Yeah, it's about movement, right? We want to keep moving to get our joints moving and feel healthy. When you have an injury, it prevents you to move. Now you're looking at speeding up the aging process. So that's what this thing is kind of cool in the sense that it's a longevity. It's like an anti-aging because you get the ability to keep your tone of the muscles and the joints and everything lined up. So then you're allowed to do exercise to stay young, to keep that body moving, and get that flow going through your body. So I look at it like both athletic side and the longevity side. I always see the 80-year-old, 90-year-old guy still walking, still being active because he's really in tune with his body. So that's how I look at this product too.
By the way, Doc, I think that's a terrific concept to share with our audiences because, folks, if you watch any of the shows before, we've talked a lot of longevity. We talked about vitality. We talked about, living the better life, the better part of your life, later on as we age. Most people, tend to decline, and we want to be, just as happy and active as we want it to be, for the rest of our life. To your point, until the end of the day, or the last day of our life, we want to be able to do things. Especially you got, your grandpa, your grandma, you want to have your grandkids with you, and it becomes very difficult. You can't do even, I mean, ADLs, right? Activities of daily living can become very, difficult. But how would it be if you don't have to deal with that, folks? So think about that. I mean, I love what you said, Doc. The idea of this is a preventative measure that keeps you going with that injury. Because at the end, to your point, that's exactly what it is. If you have pain, you can't walk, you have to get a walker, or sometimes you got to get a wheelchair. And one leads to another worst case scenario. Because if you don't walk, now you have all the other problems. Now you can have, not only just the mobility issues, but now you have weight gain. You have, weight gain comes with blood pressure, diabetes, all the three stooges that come along with that, right? And those things cause a lot of other problems in your body, and therefore you just basically are living a miserable life, and it's really painful, and you're not enjoying this world. And there's a lot to do. So I love the concept that this can be preventative. Yes, it could be a solution to when you have a problem, but certainly if applied correctly and used as a habit, of your anti-aging concept. I mean, there's a lot of anti-aging stuff out there, right? We're talking about wrinkles and stuff. This is more about pain and really living pain free. And that's actually, I think, when you don't have, like, I love what you said earlier. I mean, the athletes are going through the season because they're masking the stuff and they look good. And that's because if there's no pain, I mean, you can just keep going. I mean, when I have a bad headache or a bad fever, you just pop a couple of pills, and you look like brand new. The problem is still there. The system is not communicating. There's nothing that tells you like you have a problem. So just you cut the you cut the wire, and there's no Wi-Fi. So
Hey,
so
oh, it's funny when you just mentioned it. I just all of a sudden got a flash into the past of remember Saturday Night Live, and then Billy Crystal, right? Remember that one character he played? Goes, I forgot, it was Mr. Marvelous or something. He always says, "I feel marvelous. I look beautiful. I look beautiful," right? He goes, hey, how do you feel? He goes, I don't feel good. I look good, or something. I forgot what the saying was, but that's what I've always feel about the anti-aging cream, right? It gives you the appearance that you're healthy, you're better, but when you peel away the skin, you see inside the body, he's not healthy. He's not doing well. So that's what it's really important is being healthy, just being healthy. And then from the inside, it radiates to the outside. Then you'll see yourself get that tighter skin, that looser type of like whatever, The thing is that I always look at the inside and you make yourself better inside and it'll kind of show up on the outside.
the foundation, right? So you got to have a good foundation that is solid, sturdy, no problems, no weaknesses. I mean, if you're healthy, where you don't have pain, you can move. So walking is a big deal. It's very recommended at any age. Working out at a gym. If you don't have muscle pain or ligaments or bones or whatever joints, you're good. I mean, you can do more, right? And of course, we're not asking you folks to just go, okay, I'm getting the cream and I'm just gonna become, I'm gonna go on Muscle, Fitness Magazine and start building up like two, three
Hulk
hundred
up, yeah.
pounds. Yeah, I mean that doesn't work that way. But the idea is you will have the ability to perform, to continue your regular life without any interruption, if you want to call it that way, and keep, to your point. If you are active, you are healthier. If you're healthier, because you look younger, your system is operational, you're breathing better, you're oxygenating your body, everything else falls in place when you do it right. So, but if you have pain, I mean, just again, the example I mentioned about my son, one little pain in the shoulder, 1 week later, he's not at the gym. 1 week later, you just decline quickly. I mean, you stop going to the gym before you know it, especially as you age. No activity means a belly. And especially if you're
Hmm.
eating, sitting home watching TV, you're probably gonna have the munchies and do all the wrong stuff. So this is all connected, folks. I mean, it's amazing how one thing can change your life one way or the other if you don't do it right. So thank you. I mean, doctor, I want to just literally from here thank you for being innovative to create something that can make a difference. And this is definitely something that I would give a check mark that it's going to make a difference in lives, which people will be thanking you, in history. I mean, this is a legacy, and I'm sure there's going to be more stuff because I'm sure you're not stopping at this. You're probably going to always continue improving and finding more ways to make it better. And there's like first getting out around the world. That's one, touching all the lives around, and the cost will be also, acceptable because again, plants are pretty good, and we can even we're thinking about lab stuff, right? You can, grow plants in a controlled environment. They can be even helped. So it's not like you just you run out of stuff. You can still do this. You can make a difference. You can't grow humans. Well, maybe that's a possibility. I don't know. There's all kind of stuff going on out there. But the idea is that this is possible and it makes a difference. Now, doctor, you do have a book that I mentioned earlier. Now let's talk about the book. Has it been released? Is it just coming up now? And is it just teaching tricks about stuff, or is it really talking about just how to, matching up with the product?
Okay, so the book is on Amazon, The Future of Regenerative Medicine. You can get it right now. It's been out for about a year. And the reason why I wrote it, because I would have so many questions, and it's almost like the same questions over and over again. What are stem cells? What kind of stem cells? Why topical? What's wrong with the injections? And so instead of me always answering that same question, I just wrote a book. I said, here, read the book. It's a real simple book in the sense that there's two versions. There's a science side of it. So if you guys like to see all those type of like mechanisms and the process and understanding all that side of it, there's that side of it. But there's also the component of the layman's world where there's a journey of Jeff's discovery of stem cell. It talks about what are stem cells, the different kinds of stem cells. What does it do? And why is it really not so much the cells, but what they call the cell free, the information, the signals? And then if you understand about the signals, now it's about how to apply, how to deliver it. And then the word topical comes around. So it's a real simple book if you want to learn about this. And the neat thing about this book is that you can really get involved with the educational component. So you can express that, hey, when you go into the world of like stem cell therapy or regenerative medicine, when you go to the doctor, just don't take his word for it. Question him. Ask questions because what are these live cells? What are these cell free? What's going on? If he can't answer it in a thoughtful way, then you might have to question, does he really know what goes on? I say about 75% of doctors out there that do stem cell therapy don't really know what's going on. They just know that stem cell therapy, it works, take it. And that's just like anything else in medication too, bro. I mean, they're taught that this condition, this disease, this drug, go, and that's it. So you have to find a provider that really knows about it. And then I start with myself, and then you start with the patient and educate them, and then the book helps educate. And then challenge the doctor, challenge everybody. Use ChatGPT, Google, use all that sourcing out there online to figure out, is it true? Does it make sense? Is it just fiction? Is it just like a wild story? And then from there, you can start thinking that, all right, I understand the whole thought process, the theory, or the actual mechanism. Now it's time to get the right product.
Well, doctor, first I want to thank you for being as as open about this as and clear, because to an extent, healthcare can have a little bit of that dark side where, here's a product, take it. I mean, we hear these things all the time about, some of the products out there, especially the pills and things that you take. They solve the problem, but a lot of it, there's discussions about the lack of nutrition, savoir faire, or knowledge, right? In terms of, the medical, I guess, folks out there. So it becomes a challenging to find, and it's always good to have a second opinion. It's always good to do your research. at least be ready to ask the right questions. I think that's the biggest thing that you mentioned, Doc, is that yes, obviously doctors go to a whole concept of, education, and there's a lot, and science is moving quickly, and there's some things that sometimes, they're just not available to everybody unless they keep up. And some doctors do, but I guess not everybody is at the same pace. So sometimes they might not have the right. And again, I get from the pharmaceutical end, you get pharmaceutical reps, they present to you, here's the molecule, here's what it does, blah, blah, blah. They sell you a good, and they know how to present it, and you think it's good, and you use it, and that's it. I mean, there's that, and we leave it at that without going controversial on that part. But the idea is that it is valid that we can learn. By the way, this happened to me with a doctor one time, where I started asking questions like, "Oh, Chat GPT." Actually, they did tell me that. I'm like, well, listen, I gotta learn at least, what it is. Yes, I'm not Chat is not the expert, but it has all the expertise out there in one place. I'm not the expert. You certainly, but I'm just gonna ask the questions. So now you tell me how this is gonna apply. And frankly, that's there shouldn't be a problem with that. Now, does ChatGPT replace humans? No, I mean it doesn't, but it has access to all the intelligence that's available today. You know, by the second, to I mean literally, it's accessing it live. So you can't, even you and I, if we can go to a library and start digging in books, it's going to take us months to find all the stuff, even if it's good, maybe days. This thing spits up a response and a series of things that you could not possibly do in that speed, right? So it's okay. There's nothing wrong with that. Of course, it challenges the industries. It challenges sometimes the ego, but at the end of the day, as a consumer, we all, and by the way, all of us are patients to a degree, or consumers at a level whenever we seek service, medical or otherwise. Therefore, we need to know, and the more we learn, the better we are. I mean, that's all. Knowledge is power, right? And so it's really what you do with the knowledge. But at the end of the day, it helps. So thank you for being very transparent about this, and sharing that idea. And yes, I mean, you are a doctor, and there's no shame in the game when you actually are aware that people are going to do their due diligence. You're prepared, to answer these questions. You put a book. By the way, the book is on the screen right now. You can see the poster. I guess that's the one, right? If I'm not mistaken, behind you, right? That's yeah, that's
There it
the
is
one.
right there.
So therefore it's available. Also, I think on your website, I did, check out the website. It's free. There's a lot of stuff there. There's a lot of talk shows that you've had, previously, different, different questions, different responses. All of it comes out. So yes, folks, yeah, I think there's an opportunity here to work with Dr. Rhee here, and really let's support that, and hopefully, in a couple of months, it's available to the folks out there, and it can change the dynamics. And I'm sure this also be available to the teams out there. So that would be great. I'm assuming they're the first ones to jump on this. I hope. So Doc, am I getting this correct? Am I getting the picture right?
No, you're absolutely right. It's all about understanding what you're doing as far as taking care of your body. When you see the provider, he'll say some things, and then if you have any questions, start addressing it by your own questions from either ChatGPT. Don't take just one source, take multiple sources. And then it's your body. You got to take care of yourself. Do you trust the doctor? If a doctor challenges you saying, why are you listening to ChatGPT? That's always wrong. Then you have to question him. Goes, well, why are you so offended? If you're so right, it's no big deal. I have people ask me all the time about something that Chad said. And I love it because now my job is not just to help them along in their pain, but it's also educate them. You want to tell them, like, what structure are you talking about? What is the ACL? What is this ligament that we're dealing with? Or what is this muscle? And then I don't care. I'll bring up the old computer. We'll go through the old 1, 2 with the Google search and say, there's your muscle. That's where it starts, the origin. That's where it inserts. And that's the action. And then it goes, so what's your question? And they'll say something about ChatGPT. It goes, I get it. I see what they're saying, but they're correct this way, but they're not correct with your way because this is what you have. It goes, oh, so it's about getting them to understand. I want as a patient, I want the patient to understand that I want to have the best everything advice for you, and I want to answer all your questions because if they doubt you, your therapy with them is going to be terrible. I know that right now. So if they don't have confidence in you, then it's not going to be fun. So I want to get all their questions answered. I want to make sure that they know what's going on, and then we can move forward from that point on.
Doctor, thank you. And you know what? You're right. The relationship between a doctor and a patient is a partnership. to heal. And it takes both. I mean, one has to support the other, and one has to kind of meet the expectations of the other to be able to work. And by the way, I want to also say kudos to you for being very innovative and adaptable to technology. And because this is a big question today. AI is the new thing that everybody's fearing. You don't seem to fear it at all. You seem to actually adapt it into your realm and welcome it as a tool that is very I guess I gotta say you're a visionary on that, and so that's a big deal because a lot of people are scared from it, and this is also a good point for people on this out there because I'm a big fan of AI, believe it or not. I think I don't think it's anti-humans. I think it's a big tool for humans if we use it the right way, and I think all the experts will agree to that. The people that will fail are the people who are not adapting to it and utilizing it. I mean, it's like any other tool we've had in the past. Yes, maybe soon the robots will be there, and yes, but the robots cannot replace you or replace what you just said. They cannot, have that human factor that you have, and those are the things that people don't get. I mean, yes, ChatGPT can do the stuff. Is it going to put an ointment on you? No. Is it going to, what I mean? Those are some of the things, we just have to be clear about it, and understand it. So again, it seems like, it is an application that is part of our life that we need to just accept, whether we like it or not. It's here. It's not going anywhere, folks. So the sooner we get to it, the better we are. So doctor, thank you so much. I mean, for like sharing with us all these insights, and congratulations on a great innovation here in this field, and hopefully it will become a very common product that everybody will be using. Now, I do want to ask the question: are there any side effects? Because someone says, "Oh, another product on the market. Are they bad ingredients? Can it hurt me? Is there something that we should be considered, concerned about? Is that something that we should, toss?"
Yeah, I think the biggest thing is that if you're diagnosed with cancer, I wouldn't use it because, you don't want to regenerate cancer cells. So that's one thing you want to
Sure.
avoid. And then you're pregnant, right? You don't want to use it while you're pregnant. So those are the two big things. And then as far as like there's some of you are very sensitive in your skin. So, once you use it and you start getting a reaction to it, then, cease. So everybody's different. And then, proceed with caution when you have sensitive skins.
Those will be assessments, right? I mean, every patient is different. Obviously, you do your surveys and you figure out, allergies and all that. And those are the standard questions any doctor you go to. They get like, "Are you pregnant? Are you having this? Or you have that? Do you have any history of this?" And once you determine that, it's like, this is good, this is bad. That's what we all say. Check with your doctor to make sure this product's for you. Now, it's over the counter, and your pharmacist should also be able to give you that, right? And it's in there. So again, thank you for answering that question, because I mean, like everything else, we always have to use a little bit of side of caution, but at the end of the day, I think the odds of it, helping you are pretty ineffective as long as you don't have any extreme cases where it's not applicable. So, Doc, any words of wisdom you want to share with our audiences today before we end the show?
I guess, you need to extend yourself to things like this show, you know, research, just do your own homework. There's so much sourcing out there. You can find out exactly if that provider is telling you that you have this diagnosis or this disease, and then put it in there, check on them. I always say don't go with one person. If you don't feel comfortable with that doctor, move on. Don't just stay with someone just because you're forced to go there. Go there because this is your life. This is your condition. And if you don't, you know, blend well with him and you don't really like seem like that he cares about you, I hear about that story all the time. Move on. It's not gonna. I look. I offend people too because I sometimes people don't want to hear the truth. I'm like, this is your problem. He goes, no, it can't be that problem. He goes, I mean, this is the truth, and they get offended. I mean, I'm going to tell you the truth. I'm not going to scare you or hide or try to tell you a story you want to hear, but not really the truth. So I apologize for you guys.
Well, again, but you're right, Doc. I mean, you got to say it as it is. And that's, again, your job is to share that information. Obviously, I can always say no, right? That's my choice. But at the end of the day, you deliver the message. Here's all the options. This is what's available. This is what you have. Let's do something about it. So, Doctor, thank you so much for really being with us here today. It's been fun. I had a great time. I think we have great insights here. This is definitely a product that we should be looking forward to as it comes out in the marketplace. And that's about it. I'm Herc Nage. Hope you enjoyed our show.